Welcome everybody, and thank you for joining us today for our Facebook Live segment featuring otolaryngologists, Doctors Moshe Efrat and Satish Govindaraj, also sinus experts. Today we're going to touch upon a few different topics and also talk about how community and academic medicine work together. Just a little bit about Doctors Moshe Efrat and Satish Govindaraj. Dr. Moshe Efrat, a partner at ENT and Allergy Associates, sees patients at ENT and Allergy's state-of-the-art Lake Success office in Long Island. He's assistant clinical professor and fellowship-trained board-certified otolaryngologist with expertise and interest in facial plastic and reconstructive surgery, sinus surgery, and also specializes in office-based treatments for sinusitis and nasal polyps. He's the chair of the practice's Advanced Facial Plastics Division and also a current board member at ENT and Allergy. Dr. Satish Govindaraj is an associate professor and director of rhinology in the Department of Otolaryngology at Mount Sinai. He did a fellowship in endoscopic sinus and skull-based surgery at the Hospital of the University of Pennsylvania. In addition, comprehensive treatment of sinus disease, Dr. Govindaraj's clinical interests include endoscopic skull-based surgery, cerebrospinal fluid leaks, paranasal sinus, and skull-based tumors. So before we get into the questions, I'm just going to talk a little bit about the affiliation. Right? The affiliation started in 2007. It's truly a unique and powerful patient-focused affiliation to fight head and neck cancer. Since the affiliation began, over 12,000 patients have benefited from this affiliation. Patients at ENT and Allergy Associates who are found to be in need of tertiary care are quickly and seamlessly transferred to Mount Sinai within 24 to 48 hours, and their medical records are transferred seamlessly through our secure electronic health records, medical record system. So on to the questions. Dr. Efrat, allergies can produce many of the same cold-like symptoms as a sinus infection, including sinus pressure, a runny nose, and congestion. When it comes to allergy versus sinus problems, how can a patient ensure he or she is getting the right diagnosis?
So we see this all the time, right? And a lot of people suffer from congestion, pressure, and oftentimes it's temporary. You'll get a runny nose, you'll get postnasal drip, sometimes mild headache, all common for allergies. But sinus infections tend to be a little more severe. Their symptoms are going to last for at least 10 to 14 days, and you'll get more significant pain and headache. And one of the things you'll see is oftentimes discolored mucus or even dental pain is associated with a sinus infection. And so sometimes the symptoms are very similar and hard to tell, but if they're more severe and they last for a longer period of time, it's a good time to go see your ENT doctor and have an appropriate evaluation. Oftentimes, really checking your nose carefully with a scope, an endoscope, to check for any signs of infection.
Dr. Rush, can you add a little bit to that?
Yeah, I mean, Dr. Efrat brought up a lot of great points. One thing is, though, that, allergic rhinitis and chronic sinusitis, there's certain guidelines that we have that help us make that diagnosis. And allergic rhinitis is one of those things that just with a good history, you can pick up the diagnosis. Patients will complain of nasal congestion, sneezing, drainage from the nose, but the difference is with allergies, that drainage is going to be clear. You're not going to see any discolored mucus, as Dr. Efrat had pointed out. And allergies is something that you don't sometimes have to look in the nose to make the diagnosis, but when you talk about chronic sinusitis, that's something where, in addition to these symptoms that patients complain of, looking in the nose and trying to find some objective criteria that tell us this patient has a sinus infection is important. So that's kind of, I think, the key distinction between allergies and chronic sinusitis, where chronic sinusitis does require some objective findings in order to make that diagnosis.
That's great.
Yep.
So with that said, it's the start of summer, and we know that means summer allergies are now upon us.
Yeah.
So Dr. Efrat, how can patients tackle summer allergies, and particularly ragweed, in the months of July through October?
So controlling allergies involves like a three-pronged approach. You want to minimize exposure, you want to control your body's reaction to the allergies, and sometimes you want to actually change your body's reaction to allergies. So minimizing exposure involves keeping all your windows shut at home, putting the air conditioning on, avoiding those allergens from entering into the house. Oftentimes, all my patients are on saline irrigations, and that's like a neti pot. And if you do that daily, you're flushing out the allergens that are sitting in your nose and really causing all that reaction, that congestion, the drip. Oftentimes after a whole day at work or outside, once people with severe allergies come home, we tell them to take a shower, change your clothing so that all those allergens are off. And then there's controlling your body's reaction, and we do that with medication. So antihistamines, oral antihistamines, nasal sprays, topical sprays that are both steroid and antihistamine nasal sprays will control your body's reaction to the allergens. And then we can actually change your body's reaction by doing immunotherapy and getting treated by an allergist with allergy shots, which will actually change your body's reaction to those allergens.
Thank you. And this weekend's supposed to be a hot one, so take that advice. So, Dr. Govindaraj, next question's for you. Could patients ever confuse allergies versus CRS? How similar and different are the symptoms? But before you dive into that answer, just briefly explain what CRS is and what it stands for.
Good question. CRS stands for chronic rhinosinusitis. And the word rhino means nose, and sinusitis is, of course, the sinuses that are these chambers off of the nasal cavity that we still to this day don't know the function for. But it's very often and very easy to confuse allergic rhinitis and chronic sinusitis. Why? Because many times they can coexist. And we kind of touched on some of the differences, but for chronic sinusitis to be diagnosed, a person has to have 2 out of 4 possible criteria. They have to have nasal congestion. They have to have drainage that's either from the front or the back that's discolored. They have to have facial pain or pressure, or decrease or loss of smell. So if they have 2 out of those 4 for a period of 3 months or more, now you have enough history to say that person may have chronic sinusitis. And we touched on some of the objective criteria. So once we have those symptoms, then we need to look in the nose. Do we see any swelling where the sinuses drain? Any polyps within the nose? And if we don't see anything, but we really suspect that patient may have chronic sinusitis, that's when we may get a CAT scan. And a lot of patients misunderstand that, we can see the sinuses in the office, but when we look in the nose, we're actually just looking where the sinuses drain. And in the office, I'll kind of use the analogy that the nose is the hallway and the sinuses are the rooms off of that hallway. And unless you've had surgery, those doors are closed, so we just can't look in there unless we get a CAT scan or something else to confirm the diagnosis.
Thank you.
Yep.
So the next question is actually for both physicians.
Yeah.
We get this a lot from patients. What surgical and non-surgical treatments are out there for complex sinus diseases?
Some of the non-surgical treatments, Dr. Efrat had talked about that. Just managing your allergies, I think, is very important if you do have associated allergies. Antibiotics are not as often used, and I think patients need to understand that for chronic sinusitis. If you have an acute infection on top of that, we do use antibiotics. In certain cases, we incorporate oral steroids, such as prednisone, if someone has bad asthma or has polyps along with their chronic sinus disease. Some of the newer medical treatments we have, which I think are exciting, are steroid implants that we can use in the office setting to help improve compliance. I mean, Dr. Efrat had talked about irrigations. It's tough. Compliance is tough to have someone irrigate daily once or twice a day. And coming into the office and having, an implant that could deliver a medication to you is helpful. But I think, Dr. Any surgeries or procedures you think are worthwhile?
So a lot of those implants are for people who've already had surgery.
Yeah, true.
So for patients who've never had surgery, anti-inflammatories and topical irrigations are excellent. And now there's something that's in between true surgery and just medicine. Doing office-based balloon dilation of your sinus openings can help people with chronic sinusitis. And while this is a procedure, there's no real tissue removal. It's almost like an angioplasty of your sinus. So it's improving function.
Yeah. Recovery is a little easier with that
and
too,
recovery
right?
is very easy. Back to work in a day or two with minimal discomfort, and oftentimes just driving yourself home. So when it comes to sinus management, a lot of the management has been moving towards the office. And so, as Dr. Govindaraj was mentioning, implants are often used for people who've had prior sinus surgery who have recurrent disease or recurrent inflammation. We can manage a lot of that in the office now while you're awake.
So that actually leads me to my next question. Many patients are coming to ENT and Allergy Associates and Mount Sinai with the diagnosis of nasal polyps. what kind of procedures can be done in the office for these nasal polyps that are inflamed or
So
keep coming back?
I see these patients all the time. Many of them just want to breathe better. Oftentimes they don't really have recurrent infections. They've had prior surgery and they just can't breathe, or they have decrease in smell. So in the office we can actually remove the polyps while the patient's awake using an office-based debrider, and they have an immediate improvement in smell. And then once we remove those polyps, we can do the implants, as Dr. Govindaraj has mentioned. Sinuva is one of them. And so this is a spring-loaded implant that goes into the sinus cavity, and it releases steroid locally, and it kind of melts away the polyps, and it'll stay in place for a few months.
Yeah. Even many patients who've had prior surgery, many times we can remove the polyps in the office. It saves them going back to the operating room and having anesthesia, because some of the new implants, they're great in patients where we can see where to put them, but there's some patients who really have a very bad recurrence of their polyps where actually physically removing them is required.
You have to create that space.
Yeah,
to
exactly.
put the implant in.
Exactly. So I think the office, like Dr. Efrat is saying, is a place where we're seeing a lot more management of inflammatory sinus disease. Your recovery is a little bit faster, but there's still a role and a time and place for us to take patients to the OR, because some patients just don't feel as comfortable being in the office and being awake, and would prefer to be under anesthesia. What's interesting, we're actually doing a trial. One of my colleagues, Dr. Loretta, is an investigator looking at virtual reality as a distraction technique for patients during procedures. And the early data is looking pretty good. So that's a technique
excellent.
where you kind of distract them a little bit from what they're actually undergoing. Yeah.
Thank you. Very informative. So, the affiliation between ENT and Allergy and Mount Sinai, like I said earlier, is a real true integration of community and academic-based healthcare. Dr. Efrat, can you talk to us about how the affiliation between ENT and Allergy and Mount Sinai works? What steps are involved on your end when you need to direct a patient to Mount Sinai? How does the transfer of patients take place for tertiary complex conditions?
So we see throughout all our ENT and allergy offices, over 40 offices, we see a lot of patients. And oftentimes, a patient will require tertiary care. So we might find a significant malignancy or a very extensive disease that requires subspecialty care. And our affiliation is really using technology to its best. So if I see a patient in my office who has a malignancy, a cancer that I may want to refer to Dr. Govindaraj, one click of a button using my EMR, and his office gets notified about the patient. They get data from our chart, and the patient gets contacted within 24 to 48 hours. The patient doesn't even have to make the phone call. So they're going to get contacted, and then an appointment's going to be made. It's really seamless and works great for the patient. If you're a patient diagnosed with a cancer, you don't want that anxiety of having to try to find an appointment. Am I going to get an appointment? So here, it really relieves that anxiety.
Thanks, Dr. Efrat. Dr. Govindaraj, if you could just add on that a little bit also, your experience, working with ENT and Allergy, since 2007 with this affiliation. On your end, being Mount Sinai's physician, receiving these patients from ENT and Allergy, how seamless has it been, the integration between EMR systems, so on and so forth?
It's interesting because we've worked together and collaborated on multiple patients over the years. And many times, he'll hit that button, et cetera, but since we've known each other over the years, we still text or email one another about a patient, because many of us are OCD. And we want to make sure that patient's getting in, that I or he knows about it. And when I approach my staff about this patient that he lets me know about, my staff will say, we're already aware of the patient, they have an appointment, tomorrow or the next day. So I think it is effective. I think always in emergency settings, patients, we want to make
phone call and we can call. Obviously.
Although it's a social media world, you still have to pick up the phone once in a while, and if it's something important, that still takes precedence. But the whole process is quite seamless. Yeah.
And it's also important in terms of coordinating care. Patient's going to have some tertiary care procedure done, and they're going to be managed back in the community, and you need that collaboration.
I think is also good is that the transfer of the medical records, because many times when you have a new patient that comes into your office, the patient may not always know the complete reason why they're there and the subtleties of their condition. And I think when we have the records from the referring physician handy with us, that helps facilitate and make the visit much more fruitful for the patient.
That's great. Truly amazing. Truly amazing. And I understand that, Mount Sinai, they have their own dedicated access team, which is calling these patients back within 24 to 48 hours.
Right.
Truly, no one else is really doing that here. The tri-state area is truly remarkable.
Yeah, we deal with that in after-hours referrals and emergencies, where that transfer service is on the phone with us constantly, and they really facilitate a great deal of that transfer process.
Yep. So just a couple questions, more questions here. Are polyps likely to grow back after being removed, Dr. Efrat? If so, what are the odds and why do they grow back?
It's very confusing with polyps. Genetically, I think there's a cause and effect, and there are some patients where you can see them, and there's a very good gut feeling that you have if you remove these polyps with surgery, they're likely not coming back. And then other patients, the polyps are very aggressive. Specifically, the patients with a Samter's triad, patients who have asthma, who have aspirin allergy or sensitivity, and nasal polyps, they tend to be much more aggressive. So you really can't guarantee to a patient a polyp's not going to come back. But nowadays, after surgery, there's a lot of topical medications and management that's available to help prevent or minimize recurrence.
Thanks. So Dr. Govindaraj, a deviated septum increases the chances of sinus infections. Is that true? Is that what you understand?
That's an interesting question. The true answer, we really don't know, but there have been a few studies actually looking at sinus surgery success. And the one correlating factor they found with patients who had sinus surgery success is when they had a concurrent septoplasty. And some of the presumed theories and assumptions are that it makes access to the sinus cavity a little bit easier when the septum is straight. It facilitates delivery of topical therapy because if the septum's not in the way, then a lot of the sprays and the irrigations get in there a little bit easier. Whether a septum is so deviated where it can obstruct the sinus, many times on a scan or even on endoscopy in the office, you can see and appreciate that. And those are the patients where, yes, it could play a role.
Thank you. Also, question I have is, what home remedies do you suggest a person can do to relieve sinus issues?
So I'll tell you what was interesting. Our guidelines for allergic rhinitis actually say for those who aren't having success that acupuncture is an option. And they didn't recommend or push any other herbal type treatments, but I thought that was interesting because that's something from our academy that is off the usual pathway of what we treat patients with allergies. And the other thing too, I think we forget, that you were asking about ragweed earlier. I mean, there's certain foods that can cross-react with ragweed. I mean, ragweed, cantaloupe, cucumber, banana, things that we always eat. And sometimes when people will feel, wow, when I have that, I get a little congested or a little more mucus, and that's real.
Some people have this oral allergy syndrome.
Yep.
And so it's a cross-reactivity.
Yeah.
And your body gets confused and thinks that they're exposed to ragweed, but it's the apple.
And it's something something a lot of patients wouldn't think about, but it's something to keep in mind where with Google now you can just eat something, and if you find you're a little congested, just search it and it'll probably tell you if you have a cross-reaction or not. Yep.
Any questions from the audience? Can you just ignore allergies or chronic sinusitis? Like, what are the long-term issues you face if you ignore them, and why?
People with chronic sinusitis suffer from poor sleep, depression, so much more than just the actual symptoms of pain, pressure, and headache. But if you don't treat it and you let it worsen, you could develop a very severe acute infection that could even require hospitalization and acute, emergent treatment if you don't treat it. So I'd say symptoms that don't go away, that are fairly severe, should be evaluated by your doctor.
Yeah, that's very true. I think all very good points, and I think it's one of those conditions that's chronic. And even if you've had surgery, you don't assume that everything's fine. I think checking in with your ENT or primary, especially if you're a polyp patient, every few months just to make sure things are okay. Mucoceles are something you can see and they're silent. Mucocele, for those of you who don't know, is just an area in the sinus that's walled off and just keeps making mucus and expands like a balloon. And you'd be surprised at what those mucoceles can do, and they're still asymptomatic until a patient has a bad infection of some type. So, it's people get used to not feeling great when they have chronic sinusitis, and these things kind of grow and get out of control. And when we do surgery or an office procedure and we treat it, they actually realize they capture quality of life that they'd never had before. I think I saw a patient just yesterday in the office. We did surgery a few weeks ago, and she feels like she has so much more energy. And I think fatigue was something that used to be part of the minor criteria for chronic sinusitis, and it's not there anymore. But I think it is a real benefit they get when they're, if you're chronically inflamed, you're going to
There's
have
a point where they don't realize how good they could feel.
Yeah.
It becomes baseline. They're
Yeah.
always feeling
They
this
get
way.
used to feeling that way
and
and
then
don't
they
know.
finally get something done,
Yeah.
and wow, you're giving me life again.
Yeah.
I could breathe.
Yeah.
Yeah.
Yeah, it's tough because they ask us, what would you do? And I think that's what I struggle with, because that's a quality of life issue, and only they know how bad they're feeling. And
Everybody's different.
Yep.
So.
Yep.
Well, there's no questions from the audience at this time, so I thank you both for being with us today, and we really appreciate all this information. The affiliation between ENT and Allergy and Mount Sinai, like I said earlier, is really a true integration of community and academic-based healthcare. If there's questions from the audience, please feel free to leave them on this post. We'll get back to you. And until next time, thank you, Dr.
Right.
Moshe Efrat and Dr. Govindaraj, and thank you.
Thank you.
Thank you.